too. I just.
So we want to welcome Dr. Coggins here today and thank her for being here.
Yeah.
This is the fourth talk that she's done here, and we're so happy that she takes time to come and do this.
Yeah.
And the reason it's smaller today is because this is the fourth one, and I think everybody's come, and some people have come more than once. So word is out. They're all booking, and so now she's gonna at her sister's. So, but I will let Dr. Coggins introduce herself, and we have little cards we'll give out to you. So,
hi everybody, Janine Coggins. I been, let's see, I trained at Sisters Hospital and still there. Mostly I teach the residents, I train them, and then I have a very small private practice that is growing and with doing hormones. I am training the residents in hormone replacement. I hope to leave a legacy. I hope to leave people who can, take care of our children and our children's children. We have had 20 rough years of telling women just kind of to suck it up. It's menopause, it's natural. So this is an uphill battle for me, and just getting things going has been kind of tough. But I just added a day a month, so it's building. I'm very excited for next year. The schedule's out till 6 months, and I'm happy that I've got 3 full days a month and 2 partial days to do follow-up. So it's good. It's going to be great. Usually you have everybody say who they are and why they're here.
I want to just tell you how I got to find Janine. So when I started asking questions at my doctor, who I delivered my kids, the girl I was seeing said, "Oh, it's Mother Nature's cruel joke. Get used to it." And that was all I got. And I was like, "Oh, okay. I need to find a new doctor." So I in the meantime, I was seeing a integrative health doctor, and he actually suggested that I start taking, and I didn't really know much about it. So I did a little research, and based on his recommendation, I said, I'm going to try it. And his recommendation was brain health. He's like, I think it's really good. And his was 5 years brain health. I was like, okay, sounds good. I started, and I have all these different doctors that I go to, and I'm generally healthy, but I had joint pain, and they were like, well, maybe you have an autoimmune thing. You might need a hip replacement, different things. And once I started taking these hormones, I'm like, I'm feeling a lot different, a lot better in so many ways. And I said to my rheumatologist, I don't have joint pain anymore, and my inflammation's down. I think I'm saying it's the hormones. He was a little taken aback, but I was like, no, I really think. I go to my urologist. I'm like, I'm not in the bathroom as much. I think it's the hormones. She's like, oh yeah, it is. I'm like, why didn't you tell me that? She's like, we can't tell you that. You got to get that from your other doctor. So it's okay, these doctors aren't telling each other that this is working. So anyway, I'm going, this is something I got to stay on. So I found another, a doctor, because he's like, I can't really give you, change I don't know much about dosage, but I can put you on it. So I'm like, okay, find a doctor. That was a very hard run. So I found someone, she was completely against it, treated me horrible. I go, okay, I asked, actually Karen, she recommended her place. I went there, they were very good, excellent, I was very happy. But when it came to just changing the dose, because I was still I hadn't had a full year without a period, and so there were, you're having some breakthrough bleeding, and they didn't know how to manage that. So they're like, oh, you probably have cancer. Let's do a test and let's send you for another one. So again, I'm looking, and I kept asking all my clients, because I'm like, what are they doing? And I had one who recommended me to Dr. Coggins, and I went there, and right away she just adjusted my dosage and haven't had a problem since. So now, and since then, just been a nice journey of optimizing it, getting it just where it's supposed to be, and feeling great. So that's how I got to her, and it was a long road, and I'm so glad that I kept looking and I wanted that information. Then I want to obviously share it with everyone, because it changed my life in so many ways that I think every woman deserves this knowledge, and we should be really putting it out there.
Yeah.
So
I agree.
That's great.
I'm super grateful
We need
to
help.
you for doing that because, like Dr. Coggins wants to leave a legacy. You're leaving a legacy too by bringing women in to educate them and to get them to this
Right.
because
Yeah.
everyone
Exactly,
has a
and
story.
to ask questions and to try to find the answers,
Mhm.
so.
And my mom was part of that women's health initiative. And I feel like she is pushing me to do this because she didn't know what she was on at the time. But she was so proud to be part of this, and she was on the placebo. But she would have benefited. She had an early hysterectomy and had all kinds of issues, and I know that every single one of them would have been better. I can't say it would fix everything, but it would have just been really, she would have had a better quality of life. And so I think I know that's her way of like, you gotta get out there, get this out there. So
Can I say something?
yes,
I was thinking about it earlier.
Yeah.
And I think the one woman that was like the meanest,
Yeah.
I think she was like a catalyst for you.
oh,
Because like
she
her being so mean, like made you like, you're like, I'm not taking this as answer. You know what I mean?
It was, I honestly, it put me in such a bad, like,
No,
I was
I
so
remember
triggered by
that.
that. I was absolutely felt like someone had assaulted me the way she treated me. I mean, I wrote a big letter, but I never sent it. But I was like,
Getting it out.
I was so hurt, so hurt. I'm like,
But
you're
look at how
another
this
woman.
one's come around.
Oh, yeah.
Because
Yeah.
the first talk, she's like, oh my gosh, if I have to hear this story
I
again, I don't know about it.
No, and now I catch her up at the front desk explaining this to everyone.
I'm really for it. It's just like it's like when,
She's heard me tell it so many
it's like
times.
when you're always with your best friend, but then like you and your best friend are with a bunch of other people at different times, and you hear your best friend tell the same story over and over. It's repetitive.
I
But and this is great because obviously I tell my boyfriend all these wonderful things, and he hears about her all the time. He loves her, and so he's talking to his guy friends, and he's like, you know, your wife's probably going through menopause, and she needs your support. And I mean, picture Duffy, you know Duffy, and then he's like, you guys, you gotta understand what she's going through. It's not her fault. It's not your fault. And he's like, and there's stuff she can take to help, and he's like, and you'll both be happy, and all of that. And so he's just like, he tells every one of his friends, he's like,
That's
go
awesome.
see Sarah. She'll send your wife. She'll set her up. You know.
You got like our own underground road.
But it makes me so happy that
Did anybody follow up on that?
I think they've been a little you know, I think the guys don't know how to like broach it, you know, and I'm like, I just need to meet the wife. That's it.
Yeah, exactly. Yeah.
Well, one of them did want to be here today, but they're away, so she'll get to watch the video.
Okay, all right.
Yeah, so I love that. It's
Is
great.
there any other shoppers?
No.
Just the one.
So let's see let's go around and just say how you got to be here.
My name is Kathleen. I'm here because of Jerry, and my only experience of taking hormones is that I was given for atrophy, and then he's giving me ultrasound every couple of weeks, worrying about cancer. So like I'm saying, oh, like it's okay for women because that's what. So I'm here to.
You gotta get more information on
Yeah,
it.
no, I'm just curious, are hormones okay for women? Or, you know, I think my mother did. My mother's 94 when she was younger, and I mean, she's 94, she's doing just fine. So is there
You
a
can answer
cancer
those
connection?
questions.
Yeah.
I got
That's
answers to
gonna-
all those.
Yeah.
Jerry's a frequent
So
flyer.
I'm a frequent flyer. I'm Jerry. I am here for the fourth time. I am a super fanatical advocate, I guess you might say, because my journey has been long and creepy a little bit. Very different than Sarah's, but not any less baloney. I had my youngest child when I was 39, and then I had big fibroid tumors and stuff, and I needed a complete hysterectomy at 39, right after she was born, and I became a little bit crazy, and so the doctors put me on estrogen, and I took it for a long time, and back and forth, and like outrageous, body changes, and nobody ever had a clue what was really going on. The doctors were just like, well, you know, after a couple of years, they're like, well, you shouldn't take it for too long. Well, you probably shouldn't take it for too long. You should probably go off, blah, 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 blah. Long story short, in 2017, I was having another surgery. I had gained an awful lot of weight, and I had a bariatric surgery. I had gastric sleeve surgery, and I had to go off the estrogen for a week. And I'm like, well, they've been bugging me to go off it forever. I'm just, you know what, I'm going to go off it. Then I started in this other spiral of, because everything in my whole body had changed. And it took me like years to realize that the biggest part of the problem was the hormones. Because I was blaming everything on eating or not eating or what I was feeling or whatever. And so then I went through regular GYNs and said, oh, you've had a hysterectomy. Nah, you don't even need to come back to get checked anymore. And then I did get finally to, I describe it like this. Like, so I had the GYNs that were like the level of like, average, no help. And that was disrespectful. But then, I did find one that I went to for a while. Sarah and I were kind of parallel. She found Dr. Coggins, I found this other doctor, and she was good. She was like a lot better than these people down here. And she was, you know, a little bit more progressive, but it was still like hard line, this or done. And then we kept talking, and I'm like, no, I think I can do better. And then I got into Dr. Coggins, and, you know, it's not been an easy road because I got a lot of complicated crap going on, but I am like a new person, and I do feel like I have a doctor that is, you know, like addressing all of my everything, and we talk regularly, and I go for my follow-ups, and I'm in a 100% better place, and
I can
never
see it.
going.
Like,
Yeah, oh
you look
yeah,
amazing.
yeah.
Like,
And I
can
feel
see it.
great,
It's
and
beautiful.
yeah, it's a different world, and I feel like women have the right to have this kind of information.
Absolutely.
People in general, you know.
Yeah. Great.
That's my little story. Sorry.
Thank you. For sharing.
My name is Karen. I had a hysterectomy when I was 40, so I've been on hormones since. And I just don't feel that great. Me and Sarah, you know, she does my hair, so we're always talking hormones and how you feel and stuff. So she told me about you. I have an appointment in November, and I wanted to see you today.
Are you going to report with me in November?
Yes,
Okay, great.
yes.
I'm telling them, call ahead before you even come to see her, because you're gonna want to.
Yeah.
That's nice.
Yeah.
That's nice.
So I'm just looking for more information and testing and, you know, so forth.
And I'm Debbie, I'm here because of Karen as well.
Okay.
And I was diagnosed with thyroid disease back when I was in my early 30s. And I've battled it ever since, and I don't feel the same. And so I'm here also to get some information and hope.
What kind
Down
of
the
thyroid
road.
problem?
Pardon?
What kind of thyroid problem?
It was hyperactive, and now I'm hypo.
Mm-hmm.
But I, still feel like crap and tired and just. And
Oh,
then
we can do way better. than
recently,
that.
You had it removed though.
well, I had it radiated.
Radiated,
I
yeah.
had it radiated, and I swear, those hormones, they're not the same as your regular body hormones.
Yeah.
It's never the same again, but.
Synthroid or levothyroxine.
Yeah,
is what they have.
Roxanne, yeah. And we recently had to change it because I noticed I started losing a lot of hair and just feeling very irritable. Not myself, I'm usually a very happy-go-lucky person, and I was way off, and I knew right away my thyroid is, something's going on. So I went for a blood test, well, sure enough, everything's all on the fritz again. And so we've been, changing my medication, the dosage, but I still just don't feel great. So I'm just here to get more information as
Sure.
well.
Okay, good. We can talk about thyroid. I don't think I've done a lot of that
Yeah.
last time. Okay, who's next?
I'm Rachel. I'm here because probably about I don't even know, 4 years ago I started having a lot of pain in my hips and my joints, and I went through the whole rheumatologist thing and even orthopedic specialist, and they're like, oh yeah, you have a little bit of arthritis, and I'm like, that does not explain this pain that's going on. And I still feel like people haven't really listened to me. my rheumatoid markers were way elevated. The rheumatologist said, well, you're basically said you're fat and getting older. And I said, well, I've been fat all my life, and my markers have never been this high. And it's
Which markers are high? I'm sorry. What, the inflammatory?
the inflammatory markers.
Okay.
So they have come down somewhat, but I want to explore other things because I know the doctors just aren't right. You know your body, and I know there's something else going on. So I just want to make sure that I know what all of my options are, so I can properly advocate for myself.
Okay.
Plus, I think hormones are very crucial, and like all of a sudden, then we're expected to not have them in our body and be okay with that. Of course, that's not gonna.
Are you menopausal or perimenopausal?
Perimenopausal.
Perimenopausal.
Yeah.
Okay.
I-
Welcome.
I read something the other day, and it said something about us outliving our hormone, like so we're outliving that, and so like people don't think of it that like it stops. And I think probably a long time ago we didn't live as long,
Oh, sure.
right? And
If
so
everybody
now,
dies at 50,
right? And so it's going to take a while probably for us to get evolutionarily, right? Just a thought.
interesting.
I'm Michelle. I'm 46. In 2010, I had my left ovarian tube removed because of endometriosis and a cyst. So since then, I've gotten like little bits of hot flashes and things like that. But a year and a half ago, I got a full hysterectomy, and they just kept the one egg and took everything else out. And I had fibroids and heavy bleeding, and then they found a cyst and everything like that. So now everything's been great, except recently now all of a sudden I'm getting like really bad night sweats like a whole week. Last month, like my face was breaking out like a teenager, like crazy, like, and it just couldn't. And I changed my face wash and everything, which seemed to have helped, but I think it just like kind of comes in spurts. It like all of a sudden I'm fine, and then like I don't have like the emotions or whatever where I'm crying for no reason or anything like that. It's just the hot flashes and the night sweats. The past, like, it ended a few days ago, but the week before that, every night was insane. Like I kept waking up 3 times a night, not sleeping, throwing the covers off, like on fire. And then once it went away, then I was freezing and I'm trying to find my covers again. And then, and then like the acne. And now I've noticed like this inflammation in my feet where I'm just like kind of getting like puffy, and everyone just said, oh, just elevate. So I went for my yearly whatever, which they don't do anything there because there's nothing to pap smear and then whatever. And I'm like, why am I here? I want to talk to you about this stuff. And then she kind of like shooed me out of the room. And I got blood work done. My thyroid is fine. All my hormone levels, everything is fine. And I was just like, okay, so how do I know if I'm in perimenopausal? Well, you kind of don't, because any given day, your hormones are going to be, or your blood work is going to be different. So like when I took the blood work, my hormones were fine. So they don't know if I'm in So I said, okay, like, do I need to go on hormone? Do I need to? No, you do nothing right now. And I'm like, okay, $250 later, I got blood work done. I had to go to 2 OBGYN appointments because one was not your yearly, just to talk about whatever, and they still didn't do anything. And I've gotten nowhere. So that's why I saw this on Facebook feed, and I was just talking about it, and I showed my mom, and I'm like, oh my God, I gotta go to this. So that's why I'm here.
So you still have one ovary?
Yes.
Okay.
Everything else is gone.
Okay. Oh, I can help you.
Fabulous.
I got you. I know exactly what's going on, and I'm going to tell you.
I'm Drew.
Hi, Drew.
I came here because I just want to be educated on it. My mom is 45 and she's getting older, and she's not much educated on anything. She doesn't have any problems specifically,
Okay.
but I just want to make sure I have knowledge and stuff to help her out and tell her what she needs.
Oh, that's nice. Okay, great. Oh, great. Okay. So let's kind of get started. I'm gonna move my foot, okay? She was like me, right? I'll come back to you later. Okay, so I'll just start with when I graduated from residency, every woman went on hormones. This is probably like your mom. So they all went on Prempro, and Premarin is a conjugated equine estrogen. It comes from pregnant horse mare urine. and has at least 10 hormones, estrogens, with only 4 of which are human. And then Pro, which is the Provera, so we take a progesterone molecule, tweak it a little bit, and we got a new drug, now we can call it something else and market that, and assume that it's going to act the same in the body, which it actually really doesn't. So Prem Pro, I mean, women were just complaining, like, I'm having hot flashes, I'm having night sweats, my mood, everything, all the complaints of menopause that we have, and many were helped with the medication. In 2002, the WHI study came out. This is the one that Sarah's mom was involved in. Excellent study, a randomized controlled trial, more than 10,000 women. Part of the problem, and they all were given Prem Pro or placebo. Part of the problem is, more than half of the women were over age 63, greater than 10 years from menopause. Many of them, more than half, were smokers, had baseline hypertension or diabetes. So these were kind of sick women who were then given hormones 10 years after menopause, and there were complications with some of them. So the study was stopped early, and since that time, many of the authors, the way it got stopped was kind of arbitrary, like the authors were not consulted, it was just kind of a political move. And the main finding was never advertised, was never talked about in the media, just the finding that hormones cause breast cancer, heart attack, stroke, and blood clot. And all hormones were then lumped into this category. When the actual main finding of the study was that estrogen alone, even though it was Premarin, it was conjugated equine estrogen, showed a decreased risk of breast cancer. The estrogen alone arm. The only arm that showed an increased risk of breast cancer had the synthetic progestin in it. So synthetic progestins actually increase mitotic rate in the breast. So mitosis is cell turnover, right? The cells divide, and eventually there can be breaks in the DNA, and then that cell line perpetuates, and then you have a cancerous cell line, and that's where cancer comes from. Obviously, that's a simplistic.
And that's still something complicated.
But that's something,
Still complicated.
So if you can decrease the mitotic rate in the breast, if you can decrease cell turnover, you decrease breast cancer. So the things that decrease cell turnover is estrogen, bioidentical progesterone, and testosterone. So those hormones actually decrease the risk of breast cancer. So this terrific scare that everyone had was really about the synthetic hormone. However, we spent the next 20 years at least saying all hormones are bad. So all hormones are bad. I have had a few questions lately about the birth control pill. Well, that's been associated with blood clotting. It used to be really, really high estrogen. That's ethinyl estradiol, which is not bioidentical estradiol, number one. And number two, it's always synthetic progestins. It's never bioidentical progesterone. So, yeah, there's an increased risk of blood clots with that. There is.
Estradiol?
Ethinyl estradiol.
So the one that's not.
So in the birth control pill, that combination, the progesterone only pill is a very low dose pill, and that is not associated, but it's a very low dose of progesterone. I just lost my train of thought where I was going with all that. Hold on. Oh, guys, just give me a second. I'm just going to take some of my water.
You said people are asking you a lot about.
Yeah, so I just kind of wanted to clarify that, how that comes into play, that it is synthetic. So let's talk about the normal menstrual cycle and what the hormones in our body are doing and what happens with time. So Sarah knows I like to draw. Okay, so I guess I'll squat a little bit. So we'll just talk about the normal menses, right? So day 1 is the first day of bleeding, day 14 is ovulation, day 28 is the same as day 1. First part of the cycle, the lining layer is thick, and then we bleed down. Obviously that's menses, and then it starts to get thick again. This getting thick again is related to estradiol. Then we ovulate, day 14, And ovaries make cysts for a living, that's their job. So ovulation, the cyst ruptures, and then what's left behind, the cyst produces progesterone. Progesterone stabilizes the lining layer of the uterus. It no longer gets dense, no longer gets thicker, it just gets more dense, and then we bleed again. So in a situation where we're not ovulating, like PCOS, I'm sure many of you have heard of that, or menopause, perimenopause, the lining layer can get thicker and thicker. When we do bleed, we bleed irregular and heavy. And eventually this could lead to a precancer or even a cancer, an overstimulation of the lining layer. So unopposed estrogen in the menopause will stimulate the lining layer. So that's what they were afraid of. Were they giving you only estrogen?
It's just estradiol.
Estradiol. So only giving you estrogen without a progesterone to stabilize your lining layer could lead to an overstimulation and abnormal uterine bleeding and eventually a cancer. So I do want to talk a little bit about the rest of the hormones and kind of what's going on here. So the two-cell theory of ovulation, so this, I'm an artist, ovary. So, so the two-cell theory is you start out with, you find a cyst, the brain says find an egg, so that's FSH, stimulates the ovary to find an egg, and initially that egg is producing estradiol, E2, diol 2, estradiol, and then progesterone, which I'm going to symbolize as P4 here, based on the molecule. And the body is driving towards procreation. Make a baby, make a baby. So if for some reason you are not ovulating, the body says we need more estrogen. Make more estrogen, make more estrogen. Well, the precursors to estrogen are androgens. And I'm just going to throw a little sidekick in here. All hormones come from cholesterol. So if you're dropping your cholesterol with cholesterol lowering agents, you are making your menopause way worse. Because you are not making any of what you need here in the perimenopause. So as soon as they start putting you on those statins that decrease cholesterol, you're altering your hormone production. So the body says make an egg, make a baby, keeps making more androgens, more estrogen, and eventually hair growth. So these are your women that, and we all have these friends, fully bearded, obese, overweight, too much androgen, breakouts, who, have a really high voice. Because guess what? They got a lot of estrogen too. So this is your bearded lady who's probably not ovulating and has long-term problems, infertility. She can't get pregnant. She's not making eggs, and all of those problems lead to insulin resistance and worsening cholesterol and diabetes, heart disease. So those 13-year-old, 14, 15-year-olds who have PCOS, who are starting to have some hair growth and only having one period a year and it's really heavy, those poor girls need to be on something to protect their long-term health, number one, and to protect their ovary from making multiple cysts that never ovulate, and then this is PCOS. So those girls need to be on something that cuts down this whole cycle. And what happens is that there's a high androgen around the ovary itself. And this is a vicious cycle. So if they do go on a birth control pill or some sort of hormone that shuts down ovulation, eventually this microenvironment of androgen goes away, and then when they come off, they might ovulate for a few cycles. And that's when they can actually get pregnant. However, the vicious cycle starts again, and we're not exactly sure what happens. What is the reason? One of the theories is that insulin resistance is a cause, not an effect. So that is part of it. Okay, so what happens is that the ovary is also making androgen, making male hormone in our youth. We make testosterone. So at about age 40 is when the ovaries start kind of petering out and the testosterone is the first one to drop. when we're in our 20s and kind of hot to trot, right? Our testosterone is actually higher than our estradiol. And then as we hit age 40, you know, the women are like, this is when a lot of marriages start getting on the rocks, right? Like, what's going on? You don't want to have sex anymore. Well, you know what? The kids, we got soccer, but we got exams. Your mother's coming for dinner tomorrow. I didn't take the roast out of the oven, and now you want to have sex. I'm like, are you kidding me? So a lot of that is related to the testosterone level, the desire. Yeah, I don't have any desire. The testosterone level has dropped precipitously. So then what happens is we head out towards perimenopause, is that the brain keeps saying, find an egg, find an egg, find an egg. No, not a lot of eggs to be found. It finally finds an egg. And because the FSH has overstimulated that ovary, when the estradiol comes out, it skyrockets. When you made that skyrockets, that's your estradiol peaking to a very high level.
And coming out of your face.
So, the 5 B's of estrogen. Estrogen is the bitchy hormone. So you're not like maybe crazy, you actually are crazy. Because he's not wrong. He's not wrong. You are actually crazy. So bitchy, breast tenderness, breakouts, bloating. Did I say breast tenderness? Oh, I forgot what the fifth one was. Okay, I'm sorry. Well, anyway, there's 5 of them. It's gonna come to me. But you know, you got the bloating, you got the breast tenderness, you got the breakouts, you got the bitchiness. So, that's skyrocketing estradiol. So the one treatment to balance that is going to be to give bioidentical progesterone. So let's talk about what does bioidentical mean. Bioidentical, first of all, there's no plant that makes human hormones. There is no plant. So we have to take the plant-based hormone, take it to the lab, and turn it into human hormone. So if the bioidentical progesterone, the micronized progesterone, is exactly what your body makes. They can draw out your labs, my labs, and take that sample, test it in the lab, no one will be able to tell the difference. It's identical to human hormone, and it behaves the same way in our body. So that's what bioidentical means. I only use bioidentical hormones. They're not associated with an increased risk of breast cancer, bloating, or blood clots, heart attack, stroke. 2024 study came out, a Medicare study, looking at 19 million women. So Medicare, so they actually were over age 65, right? And ever users of hormone replacement versus never users, 19 million women. The ever users in that same time frame had half the death rate. Half the death rate. They then broke it down into 40 different hormone combinations and multiple disease states. The bioidentical combinations had really almost half or more the risk of lung cancer, colon cancer, especially colon cancer. Breast cancer ended up being a wash. So, you know, we're all at a risk of a 1 because we are women. So it didn't actually lower the risk, but looking into the study a little more detailed, they never really reached 2 milligrams of estradiol, which would be the minimum optimized dose. So I think part of it might be they just didn't give enough to really prevent it. But decreased risk of high blood pressure, heart attack, stroke, decreased risk of Alzheimer's disease, treatment and reversal as well as prevention of osteoporosis and macular degeneration. So, you know, this is a big one. So osteoporosis, right? So after the WHI said, they were like, yeah, you really can't be using hormones to prevent anything. The only thing you use it for is hot flash, just lowest dose possible, shortest amount of time. And I agree with that. If you are given synthetic hormones, do it just to treat their symptoms and then get them off as soon as possible. Even that lowest dose of estrogen in the Prempro, like there's a super low dose, improved bone mass. So when they took women off hormones, and I think it dropped by like 80% in the following year after that WHI, and has never really rebounded.
Why would anybody use synthetic hormones if bioidentical is available? Is it lack of knowledge, or are there areas where?
Well, the Provera is dirt cheap.
Okay.
So that is dirt cheap.
Yep.
I mean, it's just pennies in comparison to Prometrium. So Prometrium has to be micronized, so literally shredded, and then put into a capsule so that it can be absorbed through the GI tract.
Sorry.
No, that's fine. And one of the problems is generics then. So where do you source your progesterone from? So some of it is sourced third world, so it's cheaper. So now we can make a generic. And actually, my guru, Rosier, he went to the factories. Like, what is going on here? And in China, they push it through a sieve. They don't shred it. So then I have these women that I just cannot get their blood level of progesterone up. I mean, they're on high doses. What's going on? We are on commercial. So either switch to DAW, dispense as written, so they're getting brand name, or they have to go to compounded, where we know they're sourcing it, not third world. It's insurance does not cover compounded. It's just the lay of the land to date. So, so when they stopped all the hormones, they started big business. Let's treat osteoporosis. All of those medicines, those IV ones, the ones that you have to take on an empty stomach, the bisphosphonates, and all of their generations of medicines that came after them were all a substitute for estrogen. A substitute because they said we can't take that anymore. And none of them work well. And my dear friend, her favorite patient, had the terrible side effect of the spontaneous femur fracture. Because it does increase the calcium in the bone, but it doesn't do it the right way. It doesn't do it the normal way. You will hear some like you shouldn't go on the hormones because once you go off, then you're going to even lose more bone. Well, you will go back. You will have bone loss again if you go off your hormones. So that's a question I asked my guru. Excuse me, how old? What's the oldest that the longest you would let someone stay on? How old? He was like, "Are you going to pin me down to this?" I said, "Yeah, I am going to pin you down." He said, 110. 110. Okay. Well, wait a minute. What's the oldest that you would prescribe hormones for someone? He's, "You gonna pin me down?" I said, "Yeah, I am." He said 110. I said, "Oh, okay." So, yeah. So there's no reason that you can't take the hormones, even if you're many years from menopause. So let's talk about those cholesterol lowering agents. First of all, let's just say leading cause of death. What's the leading cause of death for women? Heart attack, not breast cancer. We cure 99% of breast cancer now. It's all everybody's getting their mammograms, and almost none of the breast cancer is diagnosed late, except for people who ignore their care, right? Early stage breast cancer, 99% cure rate. Early stage, right? So we're talking non-invasive, right? So it's like in the pre-invasive stage. So it's not breast cancer. Breast cancer's not killing us, right? So it's heart attack, it's stroke, it's cardiovascular disease. So for women, there are no studies that show that cholesterol-lowering agents prevent the first heart attack in women. So any doctor who says you got to go on these cholesterol-lowering agents has nothing to base that on. There is no study. In the best of times, in men, there's like a 4% reduction. 4%. 4% is nothing. The reduction rate in men getting testosterone therapy is about 80%.
Isn't that something?
Yes.
Oh, yeah. So don't get me started on. The only thing that we don't treat women. Women, we don't have anything for sex for women. It's all about the men, and they've got their little blue pill, and it's all about that, and all they care about is the men. Well, guess what? They don't give a shit about their men's health, okay? Because they are not giving them something that's going to protect their health. That actually increases cardiovascular strain because it causes spasm of the coronary arteries. They're not helping men with that. They're making money. They're not helping men. They're not giving them testosterone. So in men, testosterone gets converted to estradiol. Estradiol is what goes to the visceral fat. So it decreases visceral fat. Visceral fat is we're all getting it, right? Right around menopause, we start getting this balance. And we can't lose it. What is going on here? I could diet. When I was 20, I could diet. I could lose 15 pounds in a week. What's going on? I can't lose this.
Yeah.
I've had kids. Okay, all right, well. Yeah, so really we are gaining in visceral fat. Visceral fat is insulin resistance, and visceral fat is cholesterol. So elevated cholesterol, but specifically the bad cholesterol. So estradiol raises the good cholesterol, HDL. LDL is the bad cholesterol, and that's what starts raising as we go through the menopause. Once that estradiol is gone, we start raising that LDL. So LDL is apolipoprotein B. That goes to the blood vessel wall and causes plaque. It keeps building into plaque. So the LDL is what the cholesterol lowering agents actually decrease. Total cholesterol and LDL. They decrease the bad cholesterol. They do not raise the good cholesterol. They decrease the bad. So problem is, it doesn't take anything away from the vessel wall. So that's why it is not preventing the heart attack. The ApoB is already in the coronary vessels causing plaque. The only thing that decreases ApoB at the blood vessel wall is ApoA. Apolipoprotein A is part of HDL, and it goes to the vessel wall, it bonds with ApoB and pulls it away from the vessel wall. There's only one thing in the entire world that increases ApoA, estradiol. That's it, that's the only thing, estradiol. So what does estradiol do? Increases ApoA, goes to the vessel wall, turns hard plaque into soft plaque. So in the women in the WHI study who had heart attacks, they had 10 years of making plaque, they gave them a synthetic hormone, it caused immediate plaque rupture, and they had their heart attack. Women who are given estradiol, bioidentical hormones, goes to the vessel wall, turns hard plaque into soft plaque. And there's a lot more, obviously.
But that's the study that all of our health has been based on for all these years.
Yes. So actually, there's a lot more information about the smaller particles and what happens. But so for men, so I just went to part 4 of the hormone replacement course, 404, and working on getting certified. So it's, I don't know, it's like a 400. There is some money involved and there is some testing involved, and I'm kind of busy right now, but I am working on it. I'm working on getting certified. So not that it's a world renowned, it's not going to give me any world renowned title or anything like that. This is like for me to say that I did the work. I am certified. Anyway, in that course, they're talking about dosing women with even higher doses of estradiol to really get the blood level above 75. 75 is optimal. Above 100, and really increase that ApoA to lower the cardiac risk.
What do you mean the blood level over 100? What does that mean?
Yes, so when you're given a hormone, by most doctors, they're going to say, this is your dose, have a good life.
Okay.
Right?
Yeah.
You come back, nobody tests the level, nobody looks to see how you're doing with that, how do you feel? Maybe they might ask if you're still having hot flashes, okay, we can increase your patch or whatever it is. So I don't do it that way. I will both look at your symptoms and look at blood levels. I'm going to follow your blood levels to optimize your hormone levels. So when those doctors did your blood and they said everything's normal, normal is not optimal. So normal for your age is in the toilet, especially for testosterone. It's going to be like Zilcho. Estradiol is going to be very, very low. Progesterone is going to be very, very low. So your doctors look at it and go, you're normal. Well, yeah, you might be normal, which means you're increasing your risk of cardiac disease. Women's heart disease doesn't go up until the menopause. And that's when everything really starts happening. So estradiol decreases visceral fat, decreases insulin resistance. This takes time. You have to be optimized for a while. It takes at least a year of optimization before it's really, without changing anything else in your world, will start to decrease this visceral fat. So it takes time. It takes time. However, time spent feeling better, time spent managing the aches and pains, time spent, improving your bone density and actually doing something for yourself, and not just a standard script. So the risk of blood clotting, this has come up, and I'm really frustrated. This is what I'm kind of talking about this week. I have this one patient whose venous doctor told her that she probably had a blood clot, and it's all because of the hormones. She called me up hysterical. Like, he says I'm taking way too many hormones, and I'm like, okay, listen, you have osteoporosis. You're 64, and you have osteoporosis, not just thinning bones, not osteopenia, osteoporosis. if you break a hip, the mortality when you break a hip, death rate is 80% within 3 years of that hip fracture.
Oh my god.
Jeez. I have no idea.
Yeah. So this is not a game. This is how we die, right? We break a hip, or we start having these heart attacks. Maybe that the thin white woman has a much higher risk of osteoporosis, and probably that's what's going to kill her, not the heart disease, right? So we've got to get a handle on this, ladies. We've got to get a handle on this. So I said to this lady, well, okay, he's your vein doctor. You've had multiple vein strippings. Did he see a clot? No. But he said I probably had one. And that it was all the hormones. And so I've got to get off these hormones. I just got. So I said, okay. Well, if you stop it immediately, you will have a period. And I suppose that's probably not great at 64 or 65. So I don't know how I'm going to deal with her. I guess if you're going to listen to your other doctor, then that's who you need to go to, right? At some point, I have to. To me, it's almost like my reputation, right? This guy is saying that I caused a blood clot that he couldn't see, he never saw, right? So she is believing that. So he is feeling that I'm, hurting people. I mean, he could take this to the, state medical board or something and
But
try.
it feels like you could take him for basically slander because
Exactly.
he,
It's so frustrating. I feel
He
so
doesn't
bad
know,
for
but
this
it's
lady.
still,
So I don't know how I'm gonna deal with that. She's getting her blood work done and coming in October, so.
There's so much misinformation
Yes.
out there. And
Yeah.
I hear this all the time, and I read a lot of forums where women post and they're looking for answers, and they're getting such bad answers. And the one thing that they always say is, you can only use the patch, no oral, because that causes blood clot. They say it all the time.
There's nothing to back that
I
up,
know,
number one.
and so that's.
So
I
that's
would
true.
rather-
I'm just confused why this other doctor is talking about things that's totally not his specialty at all.
Stay in your lane, okay? I'm staying in my lane. I'm staying in my lane.
That's what they all do.
Stay in your lane.
I don't think he studied women's health whatsoever.
Correct.
So why is he acting like he knows it?
Exactly right.
why did they study men's health for so many years before women's? They think they know.
I mean, you're not telling him that he's doing his job wrong,
Oh,
even
no.
though he is.
Correct.
But
I was so mad. I mean, I'm a passionate woman, let me tell you. I was pissed. So yeah, I just
Well, they don't listen.
bring it on, buddy.
Yeah.
Let's
because also your goal is to help women feel better, and that person is taking away
Oh, yeah.
helping.
Oh yeah, I
someone
can't
feel
wait to
better.
see how she feels when she comes to me in 6 months when she's off her hormones. She is not going to be feeling good. She is not going to be feeling good. She's going to be, oh yeah, Coggins, can you help me? Well, I think you need to, I don't know, either quit your other doctor. Oh well, I trust him. I've gone to him for 15 years.
I think that's the worst thing is the blind faith
Yes.
that
Yeah.
people and a lot of women
But
have in a male for why I did, but that's a whole deep other thing.
I
But
do
even
not
female
have luck
doctors
with I mean, I
Yeah,
would
they
trust
do.
you over any of those other doctors because I know it's
Yeah.
working. I have proof that I'm coming out better. So I wouldn't go against, I don't care who they are, I wouldn't go against what I'm feeling because I can trust that.
The thing that I don't understand is I'm 22 and I've had a bad experience with a doctor in basically every single field that I've gone to, whether it's just regular general physician, I don't know, probably something to do with orthopedics, something dental stuff, so many things across the board. And I just can't imagine that with the healthcare system and all the issues within it and so many people not getting the help that they need, that this person hasn't experienced them for healthcare in the past, and they're not thinking about it like that. Do you know? Does that make sense?
Well, we sort of live in a litigious society too, right? So that's the thing. So some of it is fear of being sued, and I'm really stepping out of it here, right? Because those black box warnings, if you look up estrogen, it's going to say it's going to kill you, right? There's black box warnings. So doctors, they, first of all, some of them are not trained, and some of them are just gonna, I don't want to get sued. This says you got to be careful. I'm not going to be doing that. And,
Look, I'm gonna tell you something. When I went to medical school, I was a nurse first. And I really didn't want to go to medical school because I knew a lot of assholes who were doctors, okay? And guess what? When I went to medical school, I met them. They were medical students, and they were still assholes. And I was like, you know what? They were assholes. There were people who are assholes who become doctors. So that's what I got for you. I'm sorry. I'm being very honest.
Yeah, no, right.
And I'm sorry. I hope that's not on there.
But that's what I'm trying to like say. Like I've had so many poor experiences like with healthcare that like I can't understand how someone
Okay, you
can
guys really
have.
pulled that on me.
That's the truth.
It's the truth.
Absolutely the truth.
No, but the thing is, I can't understand how someone can have so much blind faith in just one person in the healthcare system
Yeah,
when like it's not in their specialty specifically.
correct.
Like that's what I
Yeah.
don't understand.
Yeah, that I found that very frustrating too. So my guru, Neil Rosat, he's snarky as hell. So he'll lay it on the line just worse than this. So he basically said, if you're gonna come to me and tell me your doctor said your thyroid functions aren't what they supposed to be, I'm gonna say go back to your doctor. You don't need to come to me anymore. And it's something I'm thinking about saying to this lady too. Like if your doctor wants to take over this, that's what we should do. We should let your doctor take over it. And so I'm that pissed, but I don't know. We'll see. We'll see how it goes. I will challenge her a little bit, and we'll see. We'll see what ends up. I was thinking of something I was going to go. I was going to talk a little bit about thyroid. Have I helped you in any way?
Yeah, you have.
You're welcome. I'm happy to see your mom if she wants to see me. Take one of my cards, hon.
Yeah.
Yeah.
He got lots of good advice. He was here for financial advice.
He's walking out afraid now. Yeah, so one of the also stumbling blocks has been of women getting the help that they need is this movement that said, well, menopause is normal and men are medicinizing or medicalizing, I can't think of the exact word, a natural process, and we shouldn't be doing that. We should just let it be. Well, I think we're smarter than that. I think we have safe, effective drugs on the market. We've got some real doozies out there that are harmful too, but we have safe, effective drugs on the market. So let's see. Let's talk a little bit about testosterone, sex drive. What does testosterone do for women? What are we doing here with therapy for women in this? So I do want to address your low sex drive. I do want to address your vaginal dryness. I do want to address what testosterone does in our body. So it actually does more for osteoporosis than estradiol. Testosterone is tendons, joints, bones, muscle. It's all of that. But it's also sex drive, and not just sex drive, it's overall drive. I'm gonna get up, I'm gonna go to the gym, I'm gonna get her done, I'm gonna make some muscle, I'm actually getting it done. This is testosterone. Yeah. Right? This is what we're missing. We're missing this as it starts to drop down. Yeah. And so I deal only with bioidentical. So usually it's a cream. There is no oral testosterone that works. It gets dissolved in the stomach acids and it does not work. Someone's here. Well, let me go see.
Just in case.
No, just in case. I'm gonna go protect you. Yeah. So
You were right.
going back, I lost my train of thought on the estradiol and the blood clots. So let's talk about that a little bit. I know. So I want to go back to the estradiol and the oral versus topical. So the topical can raise the estradiol level in the blood. However, it doesn't do anything it doesn't have the first pass effect. So first pass effect means you take a medicine by mouth, it goes into the stomach, it gets absorbed through the stomach wall and through the GI tract and goes to the liver. That's the first pass. Now the liver metabolizes that and puts out metabolites or whatever it does, first pass, and that's where the effectiveness comes in. With the synthetic estrogens, there is an increase in clotting. and especially when combined with synthetic progestins. And really, there are more and more studies coming out showing that it's the synthetic progestins that are causing the clotting and not the estrogen. So a fantastic book, which I don't see it here, Estrogen Matters, yeah. So this book, is this the newest?
I don't know if it's the
Is
newest.
this the original? Let's see. Such an excellent book. If you want to talk about, you okay?
Is it for the bathroom? And I do have a
First-
mom hat.
So this is first edition. This is just a reprinting.
Yeah.
So he is writing a new, an updated, and this talks a lot about estrogen and breast cancer risk, and it's a little outdated because he doesn't like necessarily support bioidentical, but revised and updated.
So there's,
I'll have to.
do you think there's a new one coming out?
If this isn't it, there is a newer one coming out. Outstanding book. This book is also by Neil Rosier, and this one you can get online for pretty cheap. He goes into the studies. Again, this is 2012, so there's a lot of research. This guy is on top of the research. So some of the stuff is a little bit outdated, but he talks about all the studies in more detail than this book. This book is for practitioners only, and so I have some here, I think, still for purchase. I buy them. I give them to my patients when you come into the office if you don't already own one. All of the studies are here. They're in the back of the book, and this is more of like a FYI, a briefer discussion of what the studies are showing. This is a little more in depth of what the studies show.
No, I have that one, but what was the other one that, did Neil write this one?
Yeah, How to Achieve Healthy Aging.
Okay.
So this is his updated book of this, but it's not exactly, they're not exactly. This one, again, if you're really like, no, I want to see those studies, I want to hear a discussion on those, that's the way. Okay, so now back to testosterone. I don't use methyltestosterone, which is the drug that the athletes use, and this is why it became a controlled substance. So I use bioidentical testosterone, not methyltestosterone. This is not going to be roid rage. This is not going to be any of that, but it is a controlled substance. So we have to, I can sort of get away with about a 60-day supply, maybe even a little bit more, but technically it's a 1 month supply, no refills, like it's a narcotic. So I do re-prescribe that. All of the medicines, we're going to start with a low dose, especially women who, it's been a minute since they've been through menopause. We're going to start with a low dose, minimize side effects, go up based on blood level and how you feel. And now I want to talk a little bit about thyroid. So when I first started my personal journey, I went on everything at once because Neil said, go on everything at once. How do the meds work? They work in harmony. They work together. So if his patient says to him, well, which one is making me feel better this way? All of them are making you feel better. And as I went into practice, so many primary care doctors are managing thyroid that, and of course we have electronic medical record, right? So it's not like we can say, I'm going to do your blood over here and your doctor's not going to see it. They're going to be able to see it. So, I'm going to stay in my lane. I'm not going to take over anything unless the patient really wants me to, or we get so far into the process and still have fatigue. Fatigue is, just even though you're sleeping good, you still have this fatigue. So the thyroid, let's talk about levothyroxine. So this was the greatest marketing campaign, the greatest marketing scam of all time. So they came up with, if you take levothyroxine, which is T4 only, it will bring down your TSH. So thyroid stimulating hormone, the brain says thyroid stimulating hormone, make thyroid hormone, TSH. And thyroid hormone is T1, 2, 3, and 4. T3 is what's active at the cell level. This is what gives us our energy, makes us feel better. This is what's active within the body. T4 gets converted to T3. But what they said was, well, you don't really need that T3 and T4 in that Armour thyroid. So Armour thyroid is very old fashioned. It's the original thyroid medicine. It's porcine based, so it's all the impurities are taken out, all the porcine is taken out, and it's just the T1, 2, 3, and 4. So they came along with this new drug, Synthroid, and they have made a ton of money and convinced every endocrinologist that if you lower the TSH and the T4 is in the normal range, your thyroid is euthyroid and you are cured. But you may not feel well, right? So people just still don't feel well. They still have hair loss, they still have sluggishness, they still have weight gain, dry skin, constipation, they've got all of that, and still your thyroid's normal. Like, I mean, I swear the endocrinologist that I work with all the time, who's at Sisters, even if your levels are all the way at the edge, he's like, you're normal.
See, that's what bothers me,
Yeah.
because they put you on this chart, and I'm not feeling good. I'm telling you, I'm not feeling good, but I'm normal. It's normal.
You're normal.
That's what I hear. It's normal.
So, you know, that T4 alone can suppress T3. So people just don't feel good.
And then the other thing too is I've asked them, could you please check my T3?
Mm-hmm.
And they don't do that. They don't
Yeah.
check it. She says, oh, no, you don't need to have that checked. And I said, but I want it checked. I want it checked to see what my level is.
Yeah.
You know, but they don't do that.
Well, I do all of that, and I try to get people on the thyroid immediately, even if it's a homeopathic dose, which is what the endocrine guy calls my 30 milligrams. It is a very low dose. It is homeopathic, but sometimes that's all people need. I have people who are doing great on this very tiny dose, but
Tiny dose of Synthroid?
Armour. I
Oh,
don't
Armour is
prescribe-
homeopathic?
Wait a minute.
Yep.
So is that the DHA?
No.
Okay, sorry.
So what is it you're just
Oh, I'm-
prescribing? 30?
Armour thyroid, which contains T3, T4, T1, and T2.
Oh, well, L4.
Mhm.
Okay.
No, my girlfriend's on it, right? Cameron
Yeah.
said she's on Armour, and they're not making it anymore, she said.
She said they're stopping it.
I haven't
Stopping.
heard that.
Yeah.
I haven't heard that. There's other
No?
brand names too, though. There's
Oh,
NP
okay.
Thyroid and so yeah, I don't know about that. Did she get a letter or something, or?
I
From
don't know.
from the insurance company.
Yeah, insurance
No, no,
company's
the
probably
insurance
stopping.
So it is dirt cheap.
Yeah.
Okay, it should be dirt cheap.
Ones, yeah.
It has been around forever, but they want you to fail the other hormones first. So I do have a few people who technically I've taken off their Synthroid for failed symptom, and that has worked as far as the insurance. I have other people who are paying out of pocket for it. So although it's ridiculous, it should be dirt cheap.
I started taking it, and it's funny because one of the things that I've said to my doctors forever, probably 20 years, is I get freezing to the point where it's painful. And if I'm
Me too.
outside, it takes me hours to warm up. I mean, I sleep with layers and everything, and I would
Oh.
still be freezing.
Yeah, me too.
And they're like, oh, I don't know what to tell you, I don't know what that is.
Oh,
So inadvertently, I started taking the NP or Armour thyroid, and I'm like, I'm not cold. Like I've been wearing every single day with nothing on. I'm walking around with this, and I'm not hot and I'm not cold. I'm just
Makes no sense.
temperate.
Wow.
And I'm like, this is the first time in my life that I've been.
It's weird to me.
It's very weird.
She's
She's
not
not
the one
cold.
that's so cold.
yeah.
She's like,
I'm like,
So you're-
it's freezing, and she's like, no,
All
it's
the time now.
normal.
You're
And I'm
on
like,
Armour?
Armour,
I
yeah.
thought we were on the same
Yeah, and
page
it
about
feels
this.
it's just so much better.
Is it a pill?
Yeah,
It's a
no,
prescription.
But what a difference!
So what about somebody like me who had it radiated though? Would that work for me?
So I do have people who have thyroid cancer who are 5 years no evidence of disease, 5 years cured, that I have taken over their therapy because their doctor is not managing their symptoms. Not managing the
I'm
symptoms.
frustrated too. I'm to the point.
Yeah.
I'm 70 now, and I've been dealing with this for 40 years. You know, almost 40 years.
Yeah, I
It's
would just
crap.
switch you over. Check your labs and then switch you over. So that's the way I would manage it. Yes.
Can I ask a question? But it's about the testosterone.
Of course.
So like if someone's on birth control
Mhm.
and like how you say the testosterone is like what gives you a sex drive and all those things, and like they don't tell you that like birth control lowers your sex drive, but like everyone that like takes it kind of just like knows that that's an experience that people have. So does it like affect those levels, or is it something else that's causing that, or is it like just because something else is raised?
So the testosterone is related to the FSH. So the birth control pill will suppress the FSH, follicle stimulating hormone. So there is something to that, yes. So I think it does probably, so most of the testosterone that we have, most of our androgens are coming from our adrenal glands, which also, like the thyroid and the ovaries, start to fail as we get older, right? So these levels do go down, but there is some connection with the with that.
Because
So,
I was just wondering, like, as someone who's like in like optimal age for like where your hormones would be like at the highest levels, like would it be lowered from something like birth control?
it could, yeah. So it could do that, and there's also a sex hormone binding globulin that is related to the estrogen level in our system, and it matters how much is allowed to be free, circulating in the system, being active. So the higher the sex hormone binding globulin, which goes up with estrogen, the more is bound and the less is free to act. So I don't even know if it could be something measurable. I'm not even sure of that, but I think there's two mechanisms by which it could affect sex drive.
Could a woman, like, you know, there are still people who, doesn't matter how much you tell them, they don't wanna take estrogen because they're terrified.
Mhm.
Could they still have a benefit with only testosterone, or do they need to be taking estrogen, progesterone, testosterone combined?
That is my recommendation, to take all of it, to take all of the hormones and become optimized. I do have a couple people who, so if you have a risk of blood clot, of course, you are at risk for another blood clot, right? Whether or not you're on estradiol, you are at risk for another blood clot. So if you get another blood clot and you are on estrogen, I mean, your primary is going to lose his mind. You're going to report me to the medical board for malpractice, right? I've just completely lost my mind. So all of those patients, I use topical for at least a year. So patches or vaginal cream for at least a year. And of the couple of patients that I've got, okay, it's 11 months and 15 days. Can I please go on the oral? So, okay, yeah, you are at risk for a blood clot. Please accept that you are at risk for a blood clot, and I'm going to put this in my note that you are
What
aware.
makes you at risk for blood clot?
Yeah.
If you have an increased risk already, if you have had
you've had
blood
one.
clot already,
Okay.
Oh.
But
But
if
does
you're-
it truly, does the estrogen
No.
truly?
No.
But you have to say that because.
Well, because
Okay.
synthetics do, right?
So I take estradiol vaginally now in a pill form
the
twice a
Vagicen.
month.
Okay, twice a month,
Not twice a week, excuse me.
twice a week. I was
I
gonna say,
just started that.
how much is that doing for you?
So,
Look at you, how much?
is that, you're saying that estradiol is not good for you, you're not taking,
So the amount that's actually absorbed in your system from that 2 times a week is probably not enough to stimulate your lining layer, but you know,
that would be a negative?
stimulate the lining layer
Yeah.
and cause abnormal uterine bleeding and
Okay.
lead to precancer or cancer, yes. So, you know, there have been women who are just on estrogen for hot flashes or something, that some dummy just puts them on that, and then all of a sudden they're having all this bleeding, and they've been found to have like hyperplasia or precancers, even cancers, if they're on a long term. So that's a lesson learned, that you have to balance the hormones. So the estradiol alone, just in that tiny dose that is given that way, is not going to probably affect anything much.
It's not gonna help.
It may help the vaginal mucosa. So the vaginal mucosa is highly sensitive to estradiol topically, and I mean, it's one of the things I look at women and say, let's see how things look down below, right? So I'll tell you 2 stories of ladies with the vulvar problems. So one lady, and I've told this story before, hadn't been able to have sex with her husband for 7 years because it was so painful and she was so constricted. She had a very young menopause at like age 44. She was completely through menopause, so she was about 55 at this point, and it had been 7 years, and she kind of had a history of some sexual abuse, so it was always kind of a touchy thing for her, like mentally and emotionally, how sex went, but unable. So she came to me with this problem, and we talked about the things we could do, and we started her on hormone replacement, including testosterone. I saw her in 3 months. So let me take a look down below. Take a look down below. I'm like, oh, it's looking a little better. It actually looks a little bit moist. And I stepped out. I came back in, and she was on the phone. Yeah, she said it looks a little more moist. Okay. We're gonna up the dose. She comes back in 3 months, and they have had sex for the first time in 7 years. I'm like, you guys are pretty proud of yourselves. We really are. Like, okay. Let's check the blood levels. Let's look at the dose. Okay, I think we can go up again. So we went up again, and she came back, and she is. I'm like, have you ever had orgasms? Like, she was like, oh, I guess in my 20s I might have. Not. She comes back this time now. Now she's orgasming. I'm like, okay, you guys are doing great. Right? She's like, oh yeah, he's coming in next time. Like, okay. So she had emotional problems. She was on some medications and some psychiatric issues, and sometimes you have to have a higher blood level to really overcome some of the antidepressants. And so she called me and said, something's wrong. I mean, something's wrong. I'm not having orgasms anymore. I was like, okay, all right, let's check the blood level. Let's see what's going on. So we checked the blood level, and sure enough, it was like way low. Where are we getting this medicine from? So it's coming from Pine Pharmacy, and there's no other explanation for this, nothing. I'm like, we're gonna switch pharmacies. So compounding pharmacies are not as carefully, they're not as regulated, right? So this is why the insurance companies don't pay for it. So we're gonna go to MedQuest Pharmacy, we go to MedQuest, she's better, and then she calls me and she's like, well, yeah, so I don't know what to do, so I am waking my husband up every morning to surface every morning. And he said, I'm getting tired. Okay. So we found the perfect balance. So she's waking him up every single solitary day, and I think that's a very satisfied couple. So I have a couple couples I feel like I've really saved their marriage with the testosterone. Like, we are communicating. The drive is there. He's always had the drive, and now mine matches his, and we're talking about this again. So I have another lady who, I think she was 88 when I first started seeing her, maybe 87. And her daughter, lovely lady, brought her in, and the mother had some dementia. And she had been seeing a hormone specialist, and they had put her on estrogen, testosterone, progesterone. She was on all of them, and the dementia was much improved. And she had developed, she came to see me because the uterus had completely fallen out. So we tried a pessary, we tried a couple of things. It ended up the pessary wasn't working. So we ended up doing a hysterectomy. I sent her to my friend, and they, did some procedure to push everything up. Her husband was still alive. Couldn't get a straight answer with the daughter there whether or not they were still active, but regardless, we didn't want to obliterate the vagina to prevent it from falling out, and she was doing great initially, just absolutely great, and then the hormone doctor said, well, she's 88 now, so I don't think, so he didn't want to give the hormones anymore. So she came to me and was a complete failure. The vagina was completely outside. Completely.
Oh.
Interesting.
I was like, okay. So, and then the daughter told me that they had taken her off the hormones and mentally she wasn't as good. And we put in a pessary again and vaginal estrogen. And finally I was like, I mean, I know she's 88, but I'm willing to give the hormones. I am. So I started estrogen, progesterone, testosterone. And, you know, she missed an appointment. It was winter. So it was like 6 months before I saw her. I'd send in a refill. She finally got her blood work done. Her hormone levels were optimized. And I said to the daughter, so she's just like, oh, she's a very private lady. She's not going to tell me anything. So, okay, let's have a look. Completely reversed. The vagina was completely all the way up.
Wow.
All the way up. It was a
Wow.
complete reversal.
From the hormones?
I've had complete
Wow.
reconstructive surgery.
Yep.
Oh,
Completely.
Yeah.
So my friend who actually got me kind of started on this journey, she's a family med in, we went to med school together. She's family medicine in Colorado, and she turned herself into a osteoporosis specialist and eventually a hormone specialist, and she's kind of taking a step away from her private practice, her medical practice, and just doing hormones. She does pellets, which is like a tiny grain of rice that has the hormones that slowly dissolve over like 3 to 4 months. So you have a peak level and then it slowly comes down. I tried this, it was not for me. I'm not saying it's not for everybody, but I did not like that slow decline, and then I had to use the cream, and then I was like, I'm doing everything, and no, that's not for me. I want a blood level that's, you know, maybe it varies throughout the day, but not that's gonna just slowly decline and I'm gonna feel like shit again, and then I don't want that. So that's not for me. But anyway, she said there's, you know, you don't need any of those vaginal laser, whatever fancy things that they're, I don't know if they're estheticians or what they are, that are touting now. There's nothing I can't fix in vagina and hormones. Nothing I can't fix.
Wow.
So, and I truly, I mean, it was dramatic with this lady, just dramatic. So the oral hormones themselves without vaginal, there are some people who don't get enough vaginal estrogen, even when the blood level is enough, and they still need the topical for that. But if you're using topical progesterone, nobody needs vaginal estrogen. So I think we could help that too.
I have a question, because I go to Pine Pharmacy for,
Okay.
I get topical estrogen and progesterone.
Okay.
They switched to gel,
Okay.
and it wasn't working for me.
Okay.
And they said, oh, it's exactly the same, it's just gel instead of cream.
Okay.
They were mandated to use gel if it's over 1 month. Why would that,
I have no idea.
no? You
No.
haven't heard that?
No, I don't know about that.
Hmm.
So taking the progesterone topically, it's not well absorbed, and you're not going to get a blood level. You are not going to protect your uterus from this. So now, women who don't have a uterus, people who've had a hysterectomy,
Yeah.
do you need progesterone? So that's one of the other things that, you know, once you've had a hysterectomy, you're not going to need progesterone anymore. Women don't need it. We have a progesterone receptor in every organ system in our body, including the brain, including the bones, breast, every organ system. So putting people on just estrogen, the bitchy hormone, and not balancing it is not going to make you feel great. Yes, it might take away your hot flashes and night sweats, and maybe that's enough to improve your sleep, and then you're, you know, feeling better.
I have never slept like I have since I started with progesterone.
It's the best.
And they told me, multiple times told me, because I had a complete hysterectomy, oh, no, you don't need that. What would you, what for?
So bioidentical progesterone, what you really need is oral, because you need the first pass effect. So first pass effect with the progesterone orally is improved sleep quality, decreased anxiety, main side effects. That is, you know, that's menopause, right? Anxiety, poor sleep, the irritable mood, everything. So we really need that first pass effect. You have to take it orally. Taking it topically is not enough, and it's not gonna give you those, you know, outstanding side effects. So, okay, where else do you want me to go to here? What do you guys want to talk about?
Questions?
A lot to think about, huh?
Yeah.
Yeah.
Because I only take, so I had complete reconstructive surgery, which I was, they said my things are coming out, but I had 5 children and a huge set of twins. I don't have like moodiness or anything like that. But I know, I'm not in a sexual relationship, but I do know from going to the doctors that it hurts like hell. And so I'm now, I'm taking this estrogen, because I said someday, just maybe one day, I'm holding out for that. And, but anyway, so I'm taking that, I take that, and that's really it. I've had Hashimoto's disease. I've gone down after I lost a lot of weight, so I was 150, I'm down to, I was down to 125, now I'm down to 112. It just, I guess I need less of it, but, I mean, I feel fine, I feel fine, it's just my sleepiness, like when I sit down here, I notice I'm like sleeping, but I don't know, I don't know.
Yeah, that doesn't happen to me anymore, but I know exactly what you're talking about. So, my thyroid levels are optimized. That fatigue, that never-ending fatigue, is gone. And yeah, so I know what you're talking about. And even if you think you're sleeping well, even if you are,
I guess I was curious about what does going to the bathroom have to do with hormones, because I drink a lot of water, and I drink I have green smoothies, so I feel like I eat well, but I go to the bathroom like absolutely every second. Like what goes in goes right out. I'm not losing more than I'm putting in, but it's just like crazy. I go all the time.
So the urgency, the frequency that comes with menopause is related to the urogenital mucosa. So that is what is estrogen sensitive. So the bladder mucosa and the urethra that drains the bladder atrophy when there's no estrogen or testosterone. So those things will improve with hormone therapy. So, I don't think you're probably on enough of anything to actually affect that.
Well, I ran into somebody at church, and she is a public figure here in Western New York, and she kept saying, I put on like 30 pounds and I'm eating well and I'm exercising. I didn't know what was going on. And she found people in Texas, and she said, I was looking like, what's wrong? And anyway, she went on, she said, I take all the hormones, and she goes, the weight came off. She looks fabulous, but she said I had to look the world over to find out somebody that would listen to me, and she found a doctor in Texas.
It's probably this one, this Mary Claire Haver. If anybody is on social media and you do have an interest, this will come up on your feed. This one, and Kelly Casperson is a urologist. So she just has a book. It's called You're Not Broken, and she recommends mostly estrogen cream, but she's just saying like even that alone is not going to hurt you. There's not any risk. So, but she's very frank and has a podcast. And then there is Dr. Vonda Wright is an orthopedic surgeon, and they all kind of are in the same circle, and they are doing these huge conventions, and they're going. They were on
Is this in
Oprah.
Texas?
She's in Mary Claire Haver's in Texas.
Is it
She was on
recent?
Oprah. Yeah.
So maybe that's your,
But if if you like to listen to podcasts, they all have YouTubes and podcast, TikTok. Like they give you short little stuff. I don't think she knows as much as Judine. I can swear she does not. But I mean, at least she's on the same page as far as trying to help women. But most of them are still talking about the patch, because I think that they're just not educated further.
Exactly.
Where so I would say it's better than not having any therapy.
Agreed.
But but I feel like we need to push more information out there. In fact, I did invite one of the menopause specialists today, and she wanted to come. She's out of town at the practice I used to go to, because the one day a few of the doctors came, which was nice, and I did tell her my story of what they told. She replaced that woman. She retired. So.
Oh wow.
Yeah. But she is that is her thing. She's wanting to help women with menopause. So I'm like, you really need to see Dr. Coggins.
I mean, very safe to go with topical estrogen, but is it going to optimize you? Definitely not. So the patch, you need a pretty high patch dose to get an optimal blood level. But that does nothing for the lipid profile. It does not have the first pass effect. It does nothing to improve your cardiac benefits. Yes, it might improve osteoporosis
and it may improve vaginal mucosa, but it really is not gonna prevent heart disease. So it's just not enough.
The cream, estrogen cream, is not going to prevent heart
Or
disease?
patch.
Or patch.
The cream.
Oh, so you're saying you gotta take a pill?
Outside.
For
For
estrogen, you
No,
gotta
I'm
take a
just talking
pill.
about liquid weight.
Oh,
You
okay.
need the first pass effect to affect the lipid profile. Increase ApoA.
Which for the
Yeah.
There's some like estrogen you put on your skin, or saying vaginally.
What you're using, and there's also a vaginal. There's Premarin cream, and estradiol cream that is
Oh, okay.
used like the capsule a couple times a week. Like you go on it for 2 weeks, and then it's a couple times a week. Really, for anyone who's optimized, I maybe have one patient who still has dryness even when her testosterone is optimized, and I put her on the capsules like that. Neil is putting all of his ladies on 1 milligram. Those pills are 10 micrograms, so it's a very, very small dose. But he's having them do compounded. So compounded is not going to be paid by your insurance. And I will tell you this: there is, I work at a clinic.
This is for testosterone?
Testosterone is cash.
No, that you're saying, like,
Neil's putting people on.
The estradiol, he's putting them also on estradiol
it's like.
capsules in the
it's
vagina.
combination.
Okay.
But you said it's compounded, what was the compound?
He does compound them with the testosterone.
Okay.
It could be a suppository or a
That's
cream.
my question was.
Yep, they can be together. So the compounding pharmacies, I have one patient whose insurance has a pretty decent copay. She only pays $30. One insurance company in Western New York, and I can't even remember exactly what it was, but other people we've tried to put through, like nobody. I've called the insurance companies. What diagnosis? Would you accept independent health? Would you accept is an acceptable diagnosis to give a woman testosterone? And finally, after multiple different people, I finally got someone to admit no diagnosis. There is no diagnosis. So prior auth is just bullshit
Yeah.
Yeah.
because there is no acceptable diagnosis. So, so I am treating women on Medicaid, and this really is my mission. So these women, there is not a person who will prescribe hormone replacement therapy to women on Medicaid. It is just their tough luck.
Because they don't want to, because they know that the insurance won't pay for anything they're
No,
prescribing.
they would prescribe for
They
estradiol
just-
as commercial, progesterone. The way I
Why?
do
They
it-
don't want to be bothered? They don't think
Yes.
it's worth it?
or I don't know.
They're
Right,
not
but-
knowledgeable, maybe.
Yeah,
Or they think it's not healthy.
there's that too.
Yeah.
Oh yeah, you're fat. You can't go on it.
No, we've always been told it's going to cause breast cancer
Yeah.
if you go on estrogen.
Mhm.
So like Carmen all the time
Yeah.
tell me that.
Yeah.
That's a load of crap.
Yeah.
So I have a question.
Mm-hmm.
If synthetic hormones are so dangerous, then why is birth control so normal? Is it not dangerous in the same way?
Not dangerous to add at your age. So there has never been like an increase shown to be an increased risk of breast cancer. It decreases the risk of uterine cancer because of this. So you have both hormones in it. So decreased risk of uterine cancer, and is the only drug in the world to decrease the risk of ovarian besides bioidentical hormones.
Do you treat young women like in their 20s that
few.
are on the pill but have like rheumatoid issues? Like, and they don't know why?
So glad you came.
I know. I will be contacting you.
That's nice. Good luck. I'll be happy to see you. I have a few. I'm not trying to build a practice of 20-year-olds. There's a lot of doctors out there who will take care of them, but some people are having, like I have a lady with terrible menstrual cystic acne, and I put her on bioidentical progesterone and cured it for the first time ever. I mean, she's had it for years, and that was amazing.
How about men?
I don't treat men. I'm a gynecologist.
But like say, okay, our husbands are old and they're no longer interested. Should they be taking testosterone?
So let's talk about DHEA. DHEA is it's a hormone that is a pre-hormone. It's in the androgen family.
Oh, DHEA,
Yeah,
okay.
it's a pre-hormone, and
Yeah.
it's been out there for a while. It's
Yeah.
like touted as a be-all, end-all, but it is a very good hormone. So again, it's in the androgen family, so it's specifically indicated for hypoactive sexual desire disorder, osteoporosis, and arthritis.
Okay.
So my ladies who
Oh.
come to me with the chief complaint that my joints are hurting me as I'm going
Yeah.
through menopause,
Yeah,
DHEA.
It does help.
It does, yes.
okay, yeah.
Yes.
I-
So
yeah.
for women, the starting dose of DHEA is 10 milligrams, and you need a sustained release formulation. You can buy it over the counter. You can buy it, at any health food store. You have to have the sustained release. I usually use Nutriscriptive's brand because, again, I know where they are sourcing from. It's not third world. It's pharmaceutical grade.
Mhm.
So for men, the starting dose is 50 milligrams. So your husband could go on just the DHEA
Mhm.
at 50 milligrams and go up from there. The one lady I have whose husband has had a problem, he's now able to get erections, but it's really not enough for penetration. So he's gonna probably up his dose, and that you can buy over the counter, right?
Yeah.
You don't need a doctor for that.
But
Yeah.
you don't know anyone in Buffalo that you like kind of partner with that specializes in men's
So
hormone health,
Progressive Progressive Medical does do pellet therapy. I don't love them because they are giving women estrogen pellets and not giving them progesterone. So I don't.
Yeah.
When I found that out, I was just like, okay.
Yeah.
But they will treat men. So in order to have the diagnosis of hypogonadism, they need a blood level of less than 300 on 2 separate 8 a.m. blood draws. And then their starting dose is 200 milligrams of testosterone. For women, our starting dose is 5 milligrams.
Wow.
So if you're a little bit of cream, have to touch his penis, you're not going to turn him into Roy Rage, sex maniac, your 5 milligrams is going to do diddly squat to him. So it's going to be okay. So
No.
Okay.
That's crazy, isn't it? Yeah.
Well, that's a lot of
So
good
I was
information.
on
I
birth
Yeah.
control for 13 years, and I was like the Hulk.
meaning
Like
angry,
yeah, I
mood
was.
change. So that's really the synthetic progesterone.
It was
Mhm.
like it's like psychotic snapping
Yep.
during certain.
Just
Okay.
constant irritability is really
Yeah,
related.
but-
The mood change is related to the
Yeah, so this.
synthetic progestins.
But see, I don't. So all I'm having is the hot flashes and the other stuff. But like the sex drive, I am like always had a high sex drive. It's never changed, and I
How
have
old are you now?
46.
Don't worry.
Enjoy it while you can.
This will change.
Enjoy it while you can.
No, I think you're still
Depends on what your
perimenopausal,
husband
right?
is.
So I like, how do you know that you even are perimenopausal? Just by
It's very difficult. See you ladies.
Thank you
for coming.
Thank you so much. I'm so sorry. I didn't.
At least come around and we can talk about what's what. On a personal level.
Great, thank you.
So I don't have to be anybody's gynecologist.